Today we are going to talk about a very important topic from the microbiology, that is about the anaerobic bacteria. And the biggest problem with anaerobic bacteria is that most of the medicos find it very difficult to remember their names at least, right? So there are about 14 to 15 anaerobic bacteria which are extremely important, and every doctor must know their names. Once you know their name, then we can go into detail about their pathogenesis and their diagnosis and their treatment and other things. So today's lecture will focus only that I will try my best that you remember these names of most important anaerobic bacteria, right? So one way is that let's remember a story. I will tell you a story of only 3 sentences. I will tell you a story of only 3 sentences, and these 3 sentences will help you to remember about 14 anaerobic bacteria, right? So let's start that story, right? This is a love story. Let's see that let's imagine there is love in anaerobic park. Anaerobic park. I'm not talking about Jurassic Park. Love in anaerobic park. We imagine a story, and the setting of the story is there is some sort of loving action going on in anaerobic park. Anaerobic park is our imaginary place where there are clinically most important anaerobes present over there, right? Now, story will be 3 lines, only 3 lines, but like all love stories, there will be a naughty boy, there will be flowers, there will be a virgin girl, there will be people who will be clapping and happy for this romantic arrangement, and of course, as you know, as it happens in every love story, that there is someone who is jealous and they are doing something which is dangerous. So let's go to this story. First part of the story is that we just imagine that in the anaerobic park there's a naughty boy and he finds a virgin girl, right? There's a naughty boy who finds a virgin girl. I'm not going into detail how he knows she is virgin or not, but just we suppose there's a naughty boy who finds a virgin girl and he lovingly places pink flower in her hair, soft and long silky hairs and pink flowers. So let's write it down. This is our first sentence. Let me write the first sentence. Naughty boy places pink flower. Yes. Where does he place pink flower? In virgins. Virgins. Now it's up to you. Virgins dash dash dash. Because we don't need more than this story. He may be virgin here or in her hand. What we are imagining, there's a naughty boy places pink flower in virgins. You can put it here yourself, whatever is your taste. Either virgin's hair, I feel bad, I don't have hair anyway. So, okay, virgin's hand or even virgin's mouth or whatever. But let's go back. Now, this is our first sentence, right? I will tell you 2 more sentences. We'll see the story that when naughty boy places the pink flower in the virgin's hair, then what happens? That we'll see later. First, let us decode this sentence. Let's decode. Naughty, the N. This N stands for gram negative. This stands for gram negative anaerobes. Y stands for B. B stands for Bacteroides. Bacteroides. This is a group of bacteria. These are gram negative rods. These are gram negative rods, anaerobic gram-negative rods, Bacteroides, and one of the most dangerous and most important among it is Bacteroides fragilis. Fragilis. We will discuss in detail in coming lectures, right? All clinical points related with Bacteroides fragilis. But actually, there are so many Bacteroides that we divide the Bacteroides into Bacteroides fragilis and Bacteroides non-fragilis. For a while, we just remember that B stands for Bacteroides fragilis. It's a very important member of microbiota in human lower gut, in the colon. The next places. Now what boy was doing? He places pink flower. Places. This P stands for Prevotella. Prevotella species. Prevotella species. And pink stands for places pink flower. Pink stands for, here the P stands for Porphyromonas. Porphyromonas. Now, I want to say something. We have just said that these are three important, what are these? These are three important gram-negative rods, anaerobic gram-negative rods. And F stands for, this F. This stands for Fusobacterium. 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 Here, now, all these four, this is boy, you know, these are all bacilli. They are rods. Virgin is not rod, it is coccus, right? So, these are four anaerobic gram-negative rods, right? Bacteroides fragilis, Prevotella species, Porphyromonas species, and Fusobacterium. Just one important point. When you talk about Bacteroides fragilis, you must remember that Bacteroides fragilis is most commonly isolated anaerobe from intra-abdominal infections and abscesses. Number one, Bacteroides fragilis, it is clinically very important. Clinically very important because Bacteroides fragilis, right, it is the most common anaerobic bacteria isolated from intra-abdominal infection. Actually, if due to any pathology, if it escape the colon lower gut, where it is present as a commensal, right? If it escape into peritoneal cavity or other sterile tissue, there it can produce infections and abscesses. Not only this, Bacteroides fragilis is the most common anaerobes isolated from bacteremias. The patient who suffer from bacteremias, right, if you find their anaerobic organism, most probably it will be Bacteroides fragilis, right? Another thing important about Bacteroides fragilis is, yes, don't say it is boyfriend. B, Bacteroides fragilis, boyfriend. It has a very strong helmet, very specialized and very thick and very virulent capsule, right? But these things we will talk about in detail in our coming lectures, right? Now let's move on further. So we were saying naughty boy places pink flower in virgins, suppose here. Now boy stands for Bacteroides fragilis. This piece, first piece stands for Prevotella and second piece stands for Porphyromonas. Now this Prevotella and Porphyromonas, for specific reason, I write them into black color because pigmented Prevotella and pigmented Porphyromonas are more pathogenic and more commonly producing diseases. And Prevotella and Porphyromonas, when they produce colonies, right, they make dark or black pigments in those colonies. And for your clinical point, if you want to remember a single clinical point about these two bacteria, Prevotella and Porphyromonas, when they are present in any abscess or in any suppurative discharge, they may give that discharge brownish or blackish color, right? If Prevotella or Porphyromona is present in any abscess or in what is there? Infections. Yes, no, discharging, suppurative discharge, right? That will be brownish black, and under ultraviolet light, it will it will look like brick red color, right? Where they are okay. These Bacteroides, Prevotella, Porphyromonas, Fusobacterium, they are commonly part of our anaerobic microbiota in oral cavity, in lower gut, in female genital tract, or even in the skin, right? What kind of diseases Prevotella and Porphyromonas produce, we'll discuss it later, right? Now we come to next, flower. F, it stands for, F stands for what? F stands for what? Fusobacterium. It's going to fuse, Fusobacterium. About Fusobacterium, only one thing I will mention at this point, that Fusobacterium, if it is producing peritonsillar abscess, tonsillar or peritonsillar abscess, from the peritonsillar area, Fusobacterium may invade carotid sheath, right? Carotid sheath in the neck and produce inflammation and injury to the internal jugular vein. The single most important point which I want to remember you, that Fusobacterium, they are commonly involved in orodental and orofacial infections. But one specific reference which I want to make, that when Fusobacterium produce retrotonsillar or retropharyngeal or peritonsillar abscesses, right, they drain towards the neck spaces, they reach carotid sheath, and within the carotid sheath, they specially attack internal jugular vein, and once they attack internal jugular vein, that will produce a thrombus there, and with that, thrombus will become infected with Fusobacteria. This clinical situation, pathological situation in the internal jugular vein, this is called internal jugular thrombophlebitis. So, if there is internal jugular thrombophlebitis, I must say rather septic thrombophlebitis, right? So, usually, how is this case? That usually there is a young adult, previously healthy, and he develops sore throat or severe tonsillitis, which is not resolving, right, to the regular medication, and then he develops pain in the neck, right? And if you do Doppler or CT scan or MRI, you will find internal jugular vein has a big thrombus. Actually, that thrombus is septic. Bacteria has gone up to that. And then what happens? From there, septic emboli may go to progressively bigger veins and come to the right heart. And along with that, of course, there will be bacteremia. And these septic thrombi from the right heart will be pumped to the pulmonary circulation. So produce multiple pulmonary abscesses, metastatic abscesses. And bacteremia go beyond that, and of course it can produce abscesses in many other parts of the body like brain or joints or liver, right? Many parts. Hold this situation, the primary Fusobacterium, primary infection, peritonsillitis. Secondary to that, what is there? Internal jugular vein thrombophlebitis, and that eventually lead to bacteremia and metastatic abscesses in the body. This whole scenario is called, given a very special name. The name is Lee-Murray syndrome. Lee-Murray syndrome. Lee-Murray syndrome. Now, Lee-Murray syndrome is, what is Lee-Murray syndrome? Lee-Murray syndrome is a situation, very basically, I will explain, that there is some severe orofacial orodental infection, most commonly retrotonsillar or peritonsillar abscess, and Fusobacterium are usually involved, and special type of Fusobacterium necrophorum. Fusobacterium, yes, which Fusobacterium? Let me write it here. Fusobacterium necrophorum. This subtype of Fusobacterium is very notorious to produce internal jugular vein thrombophlebitis, septic thrombophlebitis, and from there metastatic abscesses in the body, right? And this condition is called Lee-Murray syndrome. In coming lecture, we will also discuss Lee-Murray syndrome in detail, right? Another important thing, and that is life-threatening situation if not treated well. So then another important thing about Fusobacterium, that it can produce one more life-threatening situation, is that it can produce severe cellular inflammation in the under the tongue, or you can say in the floor of the mouth, involving submental triangle, bilateral area with the submandibular triangles, or even sublingual area. All these areas, if they get inflamed with multiple organisms, one of the organisms very commonly is present, Fusobacterium, and this what will happen, this area will rapidly swell up, and this area and tissue is so much swollen that sometimes it threatens our airway, right? This condition is called Ludwig angina. Ludwig angina. So one of the cause of, there are many causes of Ludwig angina, but one of the microbe which might be involved in Ludwig angina, which is also a life-threatening situation if not properly taken care, the organism, one of the organism is Fusobacterium, right? So now we know about two life-threatening situations which are produced by Fusobacterium. Number one, Lee-Murray syndrome. Number two, it might be involved in Ludwig angina. Then we come to this virgin who is very happy to receive what? Flowers. Now virgin stands for Veillonella species. Now this is gram-negative coccus. It is not bacilli, it's not gram-negative rod. Out of, now how many bacteria we learn, Veillonella species I will not go into detail. It is also present in oral cavity, in lower gut and female genital tract, but usually it is part of the mixed anaerobic infections, right? In future we will talk about mixed anaerobic infection. Again we will discuss that into detail. Now listen, it was our first sentence. What was our first sentence? Naughty boy places pink flower in virgin's hair, right? So naughty mean gram negative. We are talking about anaerobics. So we are talking about, in this line, all of them are gram negative anaerobes. Number one thing. Number two, B stands for Bacteroides fragilis, right? And I told you three things about this. Number one, Bacteroides fragilis is most common anaerobe isolated from intra-abdominal infections. Number two, Bacteroides fragilis is most common anaerobe bacteria isolated from bacteremia patients. And thirdly, I told you that Bacteroides fragilis has very, very virulent what? Capsule. Then I came to Prevotella and Porphyromonas, right? These two are present in oral cavity, very commonly involved in orodental and orofacial infections, and also in infections in which aspiration occur and pleuropulmonary infections. But they might be involved in female genital tract infections as well. The important thing about the Prevotella and Porphyromonas are that their pigmented species is more pathogenic, and in culture media they produce black colonies. And clinically, the important point is that if you have mixed infections, polymicrobial infections, and in those polymicrobial abscess or discharge coming from the wound, if it is brownish black, think of Porphyromonas and Prevotella, right? Here I want to tell you also one thing. Whenever you are thinking of anaerobic bacterial infections, remember that such infections very commonly have very offensive smell. They have very offensive smell, or we say there is malodorous discharge from these wounds, right? Or putrid smell, right? So actually it is said that if from an abscess or from a wound discharge or sinus discharge there is very offensive malodorous putrid smell, it is definitely involving anaerobic bacteria. We will discuss about this diagnostic point in future lectures when I am going to talk about the clues towards the diagnosis of anaerobic infection. And then we came to Fusobacterium, and I told you Fusobacterium, at least 2 points you remember. Number one, it produces life-threatening syndrome, Limere syndrome, in which peritonsillar infection plus internal jugular vein thrombosis and metastatic abscesses involving the lungs and liver and bones and even brain and many other tissues. It is also life-threatening condition if not treated properly. In the same way, Fusobacterium can also be part of those group of bacteria which produce Ludwig angina, which lead to severe swelling of the floor of the mouth, and it may threat our airways, and again this is also life-threatening situation. And after that I said Veillonella. Veillonella stands for what? Virgin stands for Veillonella. Here you have to remember this is coccus, and all first boy places pink flower. All these Bacteroides, Prevotella, Porphyromonas and Fusobacterium, 4 of these are very important gram-negative anaerobic rods. They are bacilli, and this is only one significant gram-negative anaerobic coccus. Now we take a break, and after the break we will go to the next sentence, and that will help you to remember all most important what? Gram-positive anaerobic bacilli and cocci. Let's have a break.